Jai Hind. Namaskar to all of you. Myself Dr. Shankar Ramchandani, founder of Rupee Clinic, Assistant Professor in the Department of Medicine, Bhimsar, Bulla. This is the photograph of a house of a man. Later, he was the founder of the Rupee Clinic. Journey from a torn and old house to a place of trust for the poor patients. So, the journey started. The child was born in a poor family with 32 members of a backward, socially and economically backward area, Padampur, including 2 members. Grandfather and uncle was suffering from deadly cancer. His father was the only source of income. Mother was helping his father by sewing the torn clothes of the poor of the people. So this was the clinical this is scenario. The thing is that poverty and disease, both combinations are with this family. So this creates a very sympathetic, a very deadly situation in the environment. Actually, what happened? Disease along with the poverty brought a drastic change in the life of a child. His father could not be able to survive his uncle as well as grandfather. He was having an aim that his child will be doctor in the future and will treat the poor and underprivileged people. So, this was the scenario in the year 2020 during the COVID pandemic situation. That child grew up to become a doctor, MD in medicine, who started Rupee Clinic. Rupee Clinic, that 1 rupee was the symbol of self-dignity for the poor patients. I could have not charged the patient, but I charge only 1 rupee to keep their respect and self-dignity. My family history, my family condition is also a story that can inspire many people. But my prime motto is to get all of you aware about some of the health tips. Actually, in the COVID-19 pandemic situation, seeing the people in the queue, hundreds of people are in the queue. Nobody was there to see the patients. There was a environment where the people don't believe, where the people don't want to see. Even the father don't want to see the children. Children don't want to see his or her parents. So this was the clinical scenario. So very pathetic situation. So in that era, being a doctor, it was my duty, because my father wanted me to be a doctor and start the society. During that pandemic situation, I started Rupee Clinic, where especially the poor, the physically challenged person and old people, old patients who are in a long queue in the OPD can have facility to be treated in the Rupee Clinic. So this is about the clinical situation. I have adopted a one leprosy colony nearby Bulla called as Junapani Kushma colony, taking their health and education. There are about 51 families comprising of almost 113 people taking their health and education. I regularly went to visit that place, taking care of their wounds with proper dressing, also distributed books and test paper to the children. My aim is to tell that don't hate leper, hate the disease but not the patient. Because most of the time I have seen, this is my, I have eyewitness that when I went to a battle shop or went to a tea shop, the people think them as untouchable. So this was the level of thinking of us regarding this leper. So third thing, we are also having, the journey started from 1 rupee clinic. In the second anniversary in 2021, I started medicine bank. The medicines are collected from the patient and the attendant of the dead patient, which remain unused. Because I am working as an assistant professor, I am earning, but I cannot purchase money for every patient. I have also limitations. So what I did, I collected money from the patient and the attendant of that patient, which remain unused. So it was useful for the others. Second, I also collected money, these medicines from the medical representative and also purchased to an extent from the Janaushadhi Kendra, so I get it in a cheaper cost. So in this way I was able to manage and I started this medicine bank. In the second anniversary of my 1 rupee clinic, I started 1 rupee shelter house. Because Burla is a place, it is having medical college, but it is interior. So communication facility is not so much developed. People are coming from Jharkhand, Chhattisgarh and the remote part of Odisha. And there was no facility for coming back to their home. So I think that these poor people will have, unnecessarily they will suffer. So I started 1 rupee shelter house. Within this, my part of my 1 rupee clinic. But my 1 rupee clinic was having a big space, so I thought that if the half of this 1 rupee clinic will be utilized for the night shelter for the poor people, it will be beneficial for the society. So in this way, in the fourth anniversary of my 1 rupee clinic, I started ECG service, as well as I also utilized my own car to ferry the patients from the leprosy colony which I have adopted. I went to the paddy fields, I measured the blood pressure, and believe me, when I measured blood pressure and sugar, out of the 240 patients, around 100 patients are having high blood pressure, even more than 200. Imagine, about 40% people, they are totally unaware of their blood pressure status. Similarly, when we measure the sugar level, it was found to be 200, even 400, up to 400, 500 I have seen. So many of the patients are not being aware of their health status. Because when they came to the hospital, what happens? They will come with cerebrovascular accident or brain stroke or heart attack or myocardial infarction. So as a physician, I feel when a patient is unable to come to the hospital, doctors who can reach to the villages. Though it is not possible always, but in leisure time, I can go to the paddy fields. When the students are enjoying seeing the movies or doing anything, I can go to the paddy field where I can at least aware the patient, at least treat the patient, at least measure the blood pressure and sugar level of the patient, so that I can tell them and so that I can also aware them, and they will take some medication and they will not, in the future they will not have cerebrovascular accident or brain stroke or heart attack. So this was my prime, and with this about 60,000 patients till now I have treated 60,000 patients. When I really, sir, I was not totally unaware of that situation that this much patient I could, a single man can see. Totally it was unbelievable, but it's the blessing of my parents that I was able to see about 60,000 patients. So one thing I want to say that it is the mindset. It's the mindset. I have no money. I was having no so much money, no manpower. But if there is a if there is a will, there is a way. So you can also do. Youth can do. You can change the era. Yes, it is true that a single man cannot change the society. If this idea will perpetuate among the youth, then I think my concept or my effort has become the fruitful. So this is my request to not only the audience present here, but my medical, as a medical teacher, to my students, give emphasis on the humanity. This profession is above the business. It is the profession where there is a trust between the patient and doctor. Doctors are regarded as second God, though I think we are not the second God, we are only the medical expert. So when the patient's going out of the clinic with smiling face, that creates a trust between the patient and doctors. And I have seen, I have observed. So I think this picture, this photograph showing the 1 Rupee Kisan Clinic in the Kendrapada Jilla, Kendrapada district. Kendrapada district is around 380 kilometers away from this Burla. But when I get time, I used to come to this place. So there is no need of building or high infrastructure or sophisticated instruments, though it is absolute necessary. But in the country like India, where we can manage with this also. So this is also a mindset. When the patients are unable to go to the doctor, doctors can also go to the patients. Our first priority is to the patient. We must not have an ego. So this is the this is the third photograph, which is showing the photograph of a colony that is called Junapani Kushta colony, as I have already told, where I used to go to the colony. Along with that, some of my students, and especially the postgraduate students, and some of my colleagues also went to the colony, and we regularly taking care of their this wound with dressing and giving some medications. So now, fortunately, now about 35 patients are totally totally free from the leprosy, and they are having some deformity. 3 patients died. Unfortunately, 3 patients died. So this is my story. All of it. If I can tell, this pictorial representation is my journey from that 1 Rupee clinic to the this 1 Rupee medicine service, then this 1 Rupee shelter house, and eventually the 1 Rupee ECG service. So I mean to say, when there is a mindset, when there is strong determination, you can do anything. Nothing is impossible, and you can try as you best you like. So with this, because I don't want to say much more things, my story itself is a story. Many things I cannot explain in this forum, but the pain behind and the situation I have observed, I have witnessed, that cannot be explained, because that is very pathetic story. Anyway, this is my short experience and my concept regarding health, that health should not be neglected, health is an important. There is a saying called, if money is lost, nothing is lost. If health is lost, something is lost. If character is lost, everything is lost. But I think if health is lost, everything is lost. Thank you.